my name is Julie Clements. I am the Chief Solutions Officer here at MOS Medical Record Reviews. Today I wanted to talk about the Stringent medical claim review that can help reduce health insurance fraud. So healthcare fraud is a serious concern that increases healthcare costs considerably. According to the CMS, U.S. spending on healthcare is projected to grow at an average rate of 6.2% annually. In healthcare fraud, false or misleading healthcare information is provided to a health insurance company with the objective of securing unauthorized benefits to the plan holder, healthcare provider, or another party. Typically, the fraud is committed either by the covered individual or the healthcare provider. Though there is only a small percentage of fraudulent claims among the millions of health insurance claims submitted to the insurers, that small percentage costs estimated tens of billions of dollars in terms of healthcare expenditure annually. This leads to higher premiums and other out-of-pocket expenses. Medical insurance fraud and Medicare, Medicaid insurance frauds constitute the majority of false claims among all the types of insurance frauds recorded in the United States. Medical Claims Review, one of the valued added medical review solutions, is a practical way to detect fraudulent claims. When a claim reviewer inspects the claim, they can notice anything unusual or incourageous in the medical claims and records. Some common types of healthcare insurance fraud. So this is from the National Healthcare Anti-Fraud Association. They have identified the following types of fraud. First one is providing medically unnecessary services for the purpose of obtaining insurance payments. Second, misrepresenting a patient's diagnosis to justify medical tests, surgeries, or other procedures that are not medically necessary. Accepting kickbacks for patient referrals. Upcoding or billing for more expensive procedures or services than were actually performed or provided. This requires inflation of the patient's diagnosis code to a more serious condition to match the false procedure code. Another is billing for services that were not provided. This is done either via identity theft or using genuine patient information to forge entire claims, or by inflating claims with charges for services procedures that never took place. Billing each step of a procedure unbundling as if it were a separate procedure, misrepresenting non-covered treatments such as cosmetic surgery treatments as covered treatments that are medically necessary, billing a patient more than the copay amount for services already prepaid or paid in full by the benefit plan under the terms of a managed care contract. Another is waiving patient deductibles, copays, and overbilling the payer or benefit plan. All of the above-mentioned fraud patterns can be detected by a trained medical chart review professional. Falsifying Medicare and Medicaid billing. This is also something very fortunate with fraudsters attempting to cheat the system. Here too, the Medicaid and Medicare programs are billed for procedures that were never performed or were performed for illegal reasons. Types of fraud could be in terms of falsified ambulance cost, durable medical equipment, prescription drugs, hospice or long-term care, and so on. Medicare.gov categorizes these three types of fraudulent claims as follows. First is false patient billing. Here, a patient may provide their Medicare number and allow a provider to bill for Medicare for unnecessary and unfulfilled tests or procedures. Second one is considered as phantom billing, where Medicare is billed for unnecessary or unperformed procedures. And the third is upbilling or upcoding. This is where the healthcare provider aims to receive additional unjustified and illegitimate Medicare funds by reporting a code that may not be relevant at all. It's surprising that in spite of the heavy penalties and consequences instituted for healthcare fraud, people engage in this kind of activity. The laws and consequences for healthcare fraud are regulated by the HIPAA and a National Coordinated Fraud and Abuse Control Program. Those found guilty of fraud could be facing a sentence of up to 10 years in a federal prison, alongside considerable monetary fines. In case of a patient was injured because of the fraud, the conviction and prison term can be extended up to 20 years. If the patient died because of these fraudulent acts, the guilty person can be sentenced to life in prison. Though the government has created many federal agencies to crack down on fraud, fraudulent schemes continue to occur. Therefore, more attention can be given to medical claims review to identify coding issues and avoid paying for illegitimate claims. This increased the significance of a medical review company providing this service. The increasing fraudulent activities in U.S. healthcare is one of the major factors that has led to the growth of the U.S. healthcare fraud detection market. According to a research and market report, the U.S. healthcare fraud detection market valued at $337.41 million in 2018 is expected to reach $1.254 million by 2024. So that's growing an estimated 24, almost 25% during the forecasted period. Insurance claims review is expected to hold a major share in the market. So that is good information to hold on to. If you have any questions on medical review or need help with that, you can go to our website and give us a call. Our website is mosmedicalrecordreview.com. Thank you.